Hello everyone, welcome to part 2 of Anatomy of Larynx. In this part 2, we are going to discuss the basic outline about the laryngeal framework as well as the cartilages of larynx. Okay, so whenever they ask a question about the laryngeal framework, okay, so what you need to write in your answers is very important because it's very confusing what comes under laryngeal framework. Okay, we know that larynx is present in the neck and it is suspending from the hyoid bone, as I have shown in part 1, a photo in the starting itself. So, whenever there is a question about laryngeal framework in both UG as well as PG, in UG you need not need to write in more detail, but PG you need to write in a more detailed manner. Okay, so what comprises of the laryngeal framework? So, first is the cartilages, as you have seen. The cartilage is of two types. One is an unpaired cartilage, and then we have a paired cartilage. Then we have ligaments and membranes, which is further of two types, intrinsic and extrinsic. Then we have muscles, the intrinsic muscles and the extrinsic muscles, and then we have the mucous membrane. Okay, this everything you have to write under laryngeal framework if they ask you as a question. Okay, so now we are going to discuss from some basic details about this larynx followed by the cartilages. Okay, so what is the thing that is very important for your Viva exam is the dimensions of male and female larynx. Okay, so I have given here a small table about the dimensions of male and female, the length, the transverse diameter, and the anteroposterior diameter. So you can just quickly go through it. And another important thing for your Viva, which is most commonly asked in UG as well as PG, is difference between an adult larynx and a pediatric larynx. Okay, that too I have given a small table over here. Just let's quickly go through this. Okay, first size, we know that adult is larger whereas this is smaller. Position, we have seen like it is from C3 to C6. This is higher in neck, usually C3 C4 only. The shape is less floppy, and here it is more floppy and omega shape. Cricoid cartilage is narrower and less circular, and here narrowest portion of the airway. Laryngeal inlet is obviously wider, and here it is relatively narrower. Vocal folds are longer and thicker. It is shorter and thinner. Subglottis is wider, and narrowest part of airway in the infants is subglottis. And these are the main important things. Others, if you can find, then it's really good. Next, we'll talk about the very important thing, that is nothing but cartilages of larynx. Okay, first let us start with the thyroid cartilage. So the first very important thing is that it is an unpaired cartilage. Okay, it's an unpaired cartilage, and I want you to zoom into this diagram. This is a lateral view. Okay, this is a lateral view of the thyroid cartilage, and you can see that it is divided into two portions. This is the anterior portion and the small posterior portion. Okay, and it also has two lamellas or the two halves. So this is the right lamella and this is the left lamella, or the right half or the left half, whatever you want to call it. Okay, and they are fusing in the midline, as you can see, and there is a depression over here which is called as thyroid notch. Okay, the dimensions of thyroid notch are different for both male and female. I have written over here, it is 90 degrees and 120 degrees. Okay, another thing which you need to focus is these extensions, okay, which are called as the superior cornua, and this is called as an inferior cornua. Okay, these are the two superior extensions, and we have a two inferior extensions. And the midpoint, the most prominent point of the fusion, is called as the Adam's apple. Okay, and there is a line that runs from the superior cornua to the inferior cornua, which is called as this oblique line. And this oblique line, it provides attachment to muscles, which is thyrohyoid muscle, sternothyroid muscle, and inferior constrictor muscle. This can be asked as your Viva question. Okay, so what are the attachments on the oblique line? Next, when we talk about the difference between the superior cornua and the inferior cornua, the superior cornua is long and narrow, whereas the inferior cornua is short, thick, and it articulates with the cricoid. Okay, these are the differences between the superior lamina and the inferior lamina. Okay, this is a very good diagram. I just want you to just go through it because it has all the membranes, all the ligaments, and the orientation. You can see this is the epiglottis, then you can see this is the hyoid bone, you can see this is the thyroid bone, this is the superior conua, this is the inferior conua, then you have the oblique line, then you have the ligaments over here. These are the greenish ones are the ligaments. Now many people usually get confused what is the difference between the ligaments and the membrane. So I have given a short table over here what is the difference between the ligament and the membranes. So I want you to quickly just go through this. I think nobody will ask, but just for your knowledge purpose, you can go through this. What is the difference between the ligaments and the membrane? Okay. Now next cartilage which we want to go through is nothing but the cricoid cartilage. Okay, cricoid cartilage, first important thing, it is a complete cartilage. Okay, what is this? This is an MCQ, or you can be asked in Viva also. This is a complete cartilage, and next thing which they can ask is the shape. It is a signet ring shape. As you can see in this diagram, this is the anterior side and this is the posterior side. Okay, and you can see it is sloping downwards. Okay, the shoulders are sloping downwards and it is narrower anteriorly. You can see it is narrower anteriorly and it is quite broader posteriorly. And you can see there are two lamella over here. This is a quadrangular lamella. This is on the posterior side. Okay, पीछे से देख रहे हो आप इस cricoid cartilage को यहाँ, ठीक है, जब आप पीछे से देखोगे तो these are the space. ठीक है, लैमेला इज नथिंग बट स्पेस वेयर द मसल्स गेट अटैच्ड. ठीक है, ये स्पेस होता है, दैट इज द क्वाड्रेंगुलर लैमेला. और इसके ऊपर वी हैव टू आर्टिकुलेटिंग फैसेट्स. वन इज फॉर द थायराइड कार्टिलेज एंड द अदर इज फॉर द एरिटेनॉइड कार्टिलेज. यहाँ पे दिख रहा है आपको, ये वाला जो है दैट इज फॉर द थायराइड कार्टिलेज और ये वाला जो है ग्रीन कलर में वो एरिटेनॉइड कार्टिलेज है. ठीक है, अभी भी ओरिएंटेशन नहीं आ रहा है तो ये पिक्चर देख लेते हैं. ओके, दिस इज अ वेरी ब्यूटीफुल पिक्चर. Just to know about the articulation, how does cricoid articulate with arytenoid and thyroid? So let's focus on cricoid. You can see this bluish thing is cricoid over here. Okay, और ये हमने lamella की बात की. This is the lamella posterior quadrangular lamina. और यहाँ पे articulation दिख रहा है आपको arytenoid के साथ. ये arytenoid है जो ऊपर बैठा है और ये articulation जो है ये thyroid के साथ आएगा यहाँ पे, मतलब यहाँ पे थायराइड के साथ आ रहा है. ठीक है, ये सिर्फ आर्टिकुलेशन दिखाने के लिए मैंने ये फोटो रखी है यहाँ पे. ओके, आई थिंक नाउ इट इज वेरी क्लियर हाउ इट इज आर्टिकुलेटिंग विद द arytenoid as well as the thyroid. Now the next one is the arytenoid cartilage itself. It is obviously a paired cartilage. Okay, you can see there are two arytenoid cartilages over here and it is articulating with the corniculate above. Okay, and as you can tell from the diagram itself that it is a pyramid shape, irregular pyramid or pyramid shape. Now, one of the most important thing is that it has two processes. Okay, so first process is nothing but the vocal process. Okay, and this is the second process which is called as the muscular process. You need not need to use more brain cells over this. Okay, muscular process because muscle attachments are there over here. Okay, we'll see in the diagram what are the muscle attachments. And vocal process quite evident because vocalis muscle, okay, is attached over here. Okay, so you need not need to use your brain cells. Why it is given as vocal process or muscular process. Okay, and you can see it is articulating with, this is the cricoid, this is anterior portion of the cricoid and this is the posterior portion of the cricoid, and it is articulating with the cricoid nicely via synovial joint. Okay, now as we told, like what are the muscles that are getting attached. This is just a brief outline to show you what are the muscles. Okay, this as you can see is the vocal process and this is the muscular process. This muscle here is the lateral cricoarytenoid muscle. Okay, this muscle over here is the posterior cricoarytenoid muscle. This muscle over here is nothing but the interarytenoid muscle. Okay, this muscle here is nothing but the thyroarytenoid muscle, and this muscle which I am shading over here is nothing but the vocalis muscle. Okay, These are the muscles which we'll talk in detail later. You just need to see why it is called as muscular process and vocal process. That's why I have given this orientation. Okay, now last but not the least, we have epiglottis. Okay, epiglottis is a thin, leaf-like elastic cartilage. Okay, so what is this? It's nothing but an elastic cartilage, which is very important. And it has two surfaces. As you can see, it has an anterior surface and a posterior surface, which is also called as a lingual surface and an laryngeal surface. Okay, it is also called as this. Different textbooks you have different things. Okay, the posterior view is concave and it is smooth, whereas the anterior one, it is covered with the mucous membrane and it leads to the formation of two folds. In this diagram, as you can see, this is the epiglottis and you have a lateral glossoepiglottic fold. This bluish thing is lateral glossoepiglottic fold, and in the midline, the dotted thing is nothing but median glossoepiglottic fold, and the depression is called as the vallecula. Okay, this is nothing but everything about the epiglottis and the cartilages of larynx.